Good morning, everyone. It's 10:04 a.m. for the October the 23rd Finance and Planning Investment Committee meeting. I believe item number 2 that was called to order, item number 2 is citizens wishing to address the committee. I believe we've got none today. That's correct. So we'll move to item number 3. So item number 3 was the approval of the minutes. I believe that was already approved, so there'll be no action on that. So that takes us to item number 4. I believe we're looking for an update on the master facility plan project. So we'll call Brian and Ramona, please.
Good morning. Before the gentleman here start, just want to provide an update from my perspective. Going forward at these updates, we're going to provide additional updates. We will continue to have the placemats available for your review, and obviously we will go over them if there's something specific we need to alert you of or update you on. But what we're going to try to do now that we're really moving forward with all the project is bring additional information. So we may bring information about the specific project and show additional renderings. We're going to show you today some of the phasing that's going to happen on the campus, but also work that we're doing with the state, with the city, in addition to other things as part of the master facility program. So just wanted to provide that update as we go forward.
Thanks, Joe. It's between us.
I don't need that for sure.
So as Jill stated, kind of a current snapshot of where we're at and walking through the next 6 months, if you will, of campus impact in preparation of the larger build projects. Wanted to just update you where we stand today. So this first slide, actually, we started almost a month ago now. And this first step is Austin coming on board. You can see them in the red area just north of the Pavilion Hospital. They are starting to prepare work for the relocation of the ambulance bay closer to Main Street so that the expansion of the Pavilion can occur. So Batson Cook is a contractor that's been on site for a bit of time now. They're relocating cooling towers that sit right in that area to make room. And this work has actually been completed now, and we have moved on to the second step. So the second step is starting to grow the contractor footprint on our campus. As you can see, Austin now takes over almost all of that area immediately north of the Pavilion. And again, this is all work in preparation of relocating the ambulance bay closer to Main Street so the construction activity can occur on the east side or the top of this picture, while the ambulance still have access in and off from Main Street near the bottom of the picture. At this time also, J.E. Dunn, as you're likely aware, has taken over the Morphe Garage. That demolition is underway along with some utility relocation and pulling utilities in for the new central utility plant that will sit in this location. And this will be our status for till approximately the end of November. Step 3, which takes place December. We still have Austin and Dunn in the center of this photo, as I just described, but J.E. Dunn also takes over the east portion of the parking garage, which is in the lower left portion of this photo. And that is the site for the MOB, Medical Outpatient Building. This is them preparing for the start of that construction. So as the parking garage crew is moving off and freeing up some space, J.E. Dunn is going to take over this in preparation for that build starting early next year. And in addition, on the far right of the screen in the purple section, south of the Pavilion parking garage, you see J.E. Dunn there. They will be setting up their field offices. This will be their location for the central utility plant, that part that's up in the middle in the center of the photo. This is where their trailers will be housed for the duration of the project. So this takes us until March of next year. And this I'll call it the final phase of our make ready. Once the parking garage opens, Austin will take over that entire parking lot that you see along the east side of Main Street today. So with the garage open, we'll have ample parking for everyone to use the new garage. And this is the site of the continued pavilion expansion and where the patient towers will sit on top of that expansion. So this condition will essentially exist from March of next year until the end of 2030. Any questions on this that I can take? All right. I will now turn over to Ramon to kind of talk about the overall schedule for the larger projects in the master facilities plan.
Thank you, and good morning, everyone. How are y'all doing? Reverend Emerson, this slide came from your request specifically. Just gonna let you know. It's a good slide though, because what we've done is we've kind of combined all of our efforts for each of the projects and put it into one timeline, if you will. So what we've got, we've designated our different phases of a project from design, construction, and we even have design and construction, because we have a lot of overlap. We have overlap where we start the enabling packages like you saw with the phasing plan, how our contractors are getting started early on while design is still going on. So starting off with the parking garage, as we all noted, that it'll be opening up in Q1, March of 2026. Again, we're only in construction there. Health Center for Women right now is finalizing their design. It'll be finalized and looking to go to permit in December of this year. So construction will start at January of 2026 with a go live of Q4 December of 2026. Our medical outpatient building, again, we're still in design, but we're starting to have that little overlap because we're starting to do a little bit of enabling packages, a little bit of utility work with the City of Fort Worth in preparation of the main construction. So this is the first time you see that kind of overlap of design and construction and how long that is taking. Same thing with the central utility plant. We'll be designing into Q2 of 2026, but that's when construction kind of starts. As you saw in the phasing plan, we're starting to capture the site. We're starting to remove things out of the way and put in our utilities. And then again, we have our go live date of Q1 of 2029. Hospital, same thing. We're in design, a little bit longer of overlap. As we've just discussed, we've taken over that site already. We've actually poured some concrete. We're starting that relocation of the ambulance bay and relocated the dock already to another location. So we're really capturing that site while the design is continuing. As you'll see in our placemats, we're still in DD's design development right now for the hospital. So you can see kind of the lengthy time that we've got of that overlap. But that's, again, all in preparation of being able to turn over this facility in Q4 of 2030. Any questions on the timeline or specifics of any of these particular projects? Okay. As Jill said, I know we've got the placemats here, so if there's any specific questions on any one project, we're happy to go over it. As Jill did say, we're going to come each month with kind of a one-off. We've been doing these placemats and they're great, don't get me wrong, but we're starting to get to the point where there's not a whole lot of things to tell you right now. But there are exciting things. I think what we're looking to bring next time that we meet, next presentation, is going to be our involvement with the city. I don't think anyone really understands how involved we are with the city. It's not just asking for a building permit. It's asking for encroachment agreements. It's asking for easement dedications. It's asking for maintenance agreements, certificate of appropriatenesses. There's a lot of documents that we have to submit to the city in order to just get the building permit, to just be able to put that shovel in the ground. So we want to kind of illustrate that for y'all, because it's not just design, it's not just construction. It's also involving our community partners, the City of Fort Worth, near Southside as well. I think we want to also take a look at how our design is progressing. We have all these different projects, a wealth of them, but they're not just individual. We're working together. We're looking at materials so that they flow together, so it looks like a campus. We don't want a one-off campus where this building was built in 19 whatever. They all look all different. And so we're trying to put a good effort in making sure that we collaborate with the materials, also with the finishes interior, you know. We don't want two different light fixtures across our campus or three different. We want to have, you know, a sense of consistency. And so we're gonna bring some of those items that we're working on behind the scenes to y'all, so y'all can see kind of the effort that not only that we're doing, but even your leadership is doing. Your leadership is part of this decision making and all the way down into the different departments that support the facilities later on. So those are what we're gonna be looking like in the future, as Jill touched on.
I just might make one comment.
Yes, sir.
I probably shouldn't say this, but I will. It's good that the Moon City is doing the work with the city. You really go, city planning department. Oh my God.
It changes every day.
Just delayed some.
Yes.
I said
Yeah.
that.
I have a question on,
Yes, ma'am.
you know, with all of this activity that's gonna be going on. I know that the construction side is gonna have their safety people, but with JPS as the owner, are we gonna have a safety?
Yes.
Someone to do that oversight?
Yeah, absolutely. Yes, we have safety as part of our facilities department, so they're kind of separate from the construction, but they are specifically going to be walking the site daily.
So number one, the contractors have to go through JPS safety onboarding.
Okay.
I know the contractors have their own, but they have to go through JPS's. JPS safety team walks the projects, I believe, every week and issues an actual report to the team.
Yeah.
That us, as you know, managers of the overall program, we're gonna be dissecting and then going in and finding the deficiencies and getting those corrected before the next report comes out.
Yeah.
So yes, ma'am.
This is a big deal.
Big deal. They're gonna be
Yeah.
entangled with us in construction, no matter what. And they do attend all of our meetings as well. So they're not just brought in when needed. They're brought in at every single one of our contractor, our owner, architect and contractor meetings.
Awesome, you're gonna be busy.
Oh, you're telling me. Yes, ma'am, we are. We're gonna get very busy. So we're excited about it.
Demetria, our accreditation requires us to have those safety checks in place for any construction in order to protect you, your patients, your community, or your staff. And so that's a requirement.
Thank you.
Quick question about the garage.
Yeah.
Is the south side along 1350 south? Yeah. Is that gonna be spring clad like the others, or is that staying with the cable?
No, that's staying with the cable. It does not have the wraparound of the site.
I asked that, have we looked, so my office sits there and I can probably read a newspaper of the guys that are working in the garage. I am fairly confident they could also read the stuff on my desk. Have we talked about that for clinics that are gonna be facing that anytime? I mean, screen
Yeah,
or?
we have been talking about it. You know, probably we'll do something on the JPOC
With
side
renovation.
versus the garage. But yes, we have been looking at that and that will get addressed and figured out depending on, you know, what exactly is going to be on that JPOC side.
I know
So
like clinics will eventually be doing it, but.
exactly. But yes, it's still important to
It's
have.
powerful, like I'm trying to look for right now.
Yes.
Thank you.
All right. Thank you guys for that update. So on to item B, this will be presented by Kim Hodgkinson. It's going to be consider approval of professional service agreement between Tarrant County Hospital Districts and Hilltop Security Assets Management.
Are we doing the financials?
I'm sorry. Oh, I'm sorry.
We can
My
skip them if you
apologies.
want.
Okay. So item 5, these will require actions from the board. So we've got item A is our CFO update to consider the approval of our 2025 unaudited financials.
Perfect. Thank you, Mr. Chair. So up on you have the packet in your materials and the PowerPoint. We'll just go over some key high things. The themes haven't really changed in the past few months. We've had strong volumes, so they've been sustaining themselves. Everything has been pretty much above plan. We've been very busy. The revenue is actually strengthened by the volumes primarily. We do have a lower rate activity, which means per unit or per patient, we're getting paid less. And that's primarily be driven by an increase in Medicaid and self-pay patients that we've been seeing in the organization. The retail pharmacy, particularly the specialty pharmacy, has really continued to show momentum and is growing. And then expenses relative to the budget, we've aligned very well this year on the expenses around labor and what we had planned for this year. For supplemental Medicaid funding, we did have, just a reminder, the disproportionate share hospital funding was reduced for the last 3 months of the year. So the 7 million, we did not recognize in the month of September. There was actually a total of 9 million unfavorable because we did have a prior year dish settlement that also impacted the month of September. And so we saw a negative $9 million hit supplemental funding for the month. So September wrapped up a solid year for us. And then as we know, we are actually in the first 3 weeks of the new fiscal year and we're moving forward with that plan. But a little bit more on 26, the income statement was provided to you. I will note the total operating revenue, which is the first bolded line. There you'll see year to date, we had revenues of just under $1.3 billion for our services. Last year it was just 1.2. So we were seeing a growth in our revenue in that space, primarily related to patient volume and the pharmacy space. Wages and benefits, you'll see for the year, we're at just over $1 billion. For those last year, we're slightly under. We do have annual wage increases. We did need to do a market study this year, and we've had a slight increase in benefit costs. Primarily, we're seeing it in the pharmacy space. Relative to other operating expenses, we saw those relatively some small inflationary increases. You may see the favorable variance in purchase services for the year. We had some initiatives planned that we chose not to participate in this year. And then we also have some delay in initiatives due to just the contracting process and the RFP process. And those processes are being streamlined right now. So we'll be looking at how we accelerate that moving forward. But the operating income, you'll see once we include the ad valorem, this graph is your cumulative. Again, a reminder, the red line is budget, green is prior year, and blue is the current year. Cumulative, you'll see the last quarter is relatively flat, again, because of the dish funding that was reduced for the fiscal year and recognized in the third quarter. We ended up the year at an operating margin of 7.9% relative to budget of 2.1. Last year, we were at 11.4. You may ask, what did you tell us when we were at the budget? Well, we thought at budget time we'd be at about 6.9. So we were pretty close when we were at the budget. We had some more favorable activities in the last quarter that caused it to go up a little bit more than we thought. But that change from last year, 11.4 to 7.9, is about $70 million. That's the difference there. To give you an idea, the 60 million reduction in dish is a big portion. We can talk about a bunch of lots of volume, lower rate. We can talk about a lot of pluses and minuses. But if you think about that 70 million, 60 of it alone is the dish funding that was reduced during the year. The key performance, this is the monthly key performance drivers. I provided in your packet, so you just have an idea of what the big things are, and we've talked about these already. The run rate, though, it goes from budget of 3 million for the month for operations. The actual run rate is operations. That's really what we've generated from operations. In September, it was 3.8 million. The one-times are the things not related to the month, and they canceled each other out. We had the a supplemental dish payment for a prior year, as well as we did need to decrease the reserves on our accounts receivable model based on doing hindsight reviews in preparation for the audit. And so about 3.6 million is the performance for the month. The performance ratios went too fast. The performance ratios, we talked about operating margin. The key ones as the board that I'd really focus in on is looking at overtime and contract labor. As those increase or decrease, those are good indications of where we are with our labor force. Our FTEs show an increase from last year. However, the FTEs per adjusted patient day has gone down since last year. And that's because the volumes went up. And so, again, the FTEs better than performed than we had planned in the budget. The days cash on hand are below. We are at 452, 257 in the future fund, 195 for the operating fund. We expect from this year, in the excess of budget, to put another $66 million away in the future fund. For this year will be coming later at the next board meeting to get approval to move that to designated assets. This chart is in your packet. It's very detailed. I do square off the big things. So inpatient activity, that is the biggest revenue generator right now that we have. Again, we have the discharges on the first, plus we add observation, because those are patients in our beds. And they are taking the resources just as the inpatients are. So about 49,000 occupying those for the year. We go down to acute discharges. You'll see we already mentioned length of stay. Surgery cases are up. Emergency room is up. I guess volume is just this is the V word. I think the medical staff was laughing about it last medical staff meeting. Dr. Casey became the V word. So as we move forward, it's the payer mix at the bottom is the biggest thing that I want to focus on today is we are seeing that shift. It does look like commercial is going down. We are seeing a slight decline in the commercial business. We're seeing the increase in Medicaid and self-pay as we move into the summer months, or excuse me, the fall. The last page of the presentation are the financial goals. Some of them are subsets of the last page, starting with the operating margin. Of these goals, 8 of the 10 have hit stretch for the year. One, operating revenue per adjusted patient day is just below stretch, and then length of stay continues to be a challenge. Length of stay is just a challenge because of the populations, the payer sources we have, and also limitations in the community for these various populations. If they're homeless, discharging them to home care is almost impossible. If they are a Medicaid or a connection patient, getting them sometimes into a long-term care facility is a challenge. We are working through all of these, making sure we can get patients into the right level of care so that we can free up our beds for the higher level of care.
Was this in the packet?
Mhm.
This is posted to the portal.
It's in here. Mhm.
So that wraps up 26. We are, I'm just gonna flip to the next section, 'cause I just put those in the agenda. That wraps up 26. We continue to work with the auditors. We are reviewing some payments that we have gotten subsequent in the last week and whether we will recognize them in 25. So again, the financials presented are unaudited. And so we plan to present the final audit at the early December joint meeting. We are starting, as I mentioned earlier, 26. I almost said 27 because I'm already thinking about the budget for 27. We've started 26. We've made some great headway. This past week, we started the assessment on the revenue cycle with the external firm that I've brought in to do a very quick assessment to really how do we move forward on revenue cycle. And we've really identified some opportunities for us to have some wins this year to align with the initiatives in that space. And then the capital planning, we have initiated all the capital plans for moving forward so that we can get as much done in this fiscal year as possible to move us forward. So I'd end that with any questions on the 26 financials? 25, sorry.
You know, when you guys went to Commissioner Court and you and Kim's up there and they were asking all of those questions, but it was kind of confusing. He kept asking about the budget. I mean, what was it? Like I guess we budget over what we actually make or?
Yeah.
I mean, was that ever?
Yeah.
I mean, what was that? Like, 'cause I was kind of like
So
all over the place with that. It was
Yeah.
kinda confusing.
So I
Welcome to
think
my world.
it was,
Because they're not terms we often use.
right, it was under budgeting revenue, over budgeting expenses, so under budgeting our bottom line. The unfortunate part for us is that many of the reasons are things that we can't project. These supplemental payment settlements. We just got another one and it's not huge, but these are just unearned, so they have to allocate the monies out, or they're doing recoupments or they're doing rebasing. And these are just not things we can project. At the last meeting, I did try to go through that with the finance and board, because we did it at a joint meeting, to really say, here's the reasons. So he had looked at 2020 and forward. The first 3 months of that look, COVID was the biggest culprit, right? We got $250 million of COVID funds that nobody projected across the country. This isn't just unique to JPS. And then we also in 2020, we had Medicaid UC was rebased, and we went from getting very little to 100 million in 1 year. So no one can project that. And then the second set of 3 years that was looked at in that conversation really centered around volumes, investment performance, and supplemental payments. And so there are reasons that it looked, I think when we do the budget, we use the best lens we have at the time. And then during the year, we have to adjust accordingly. And fortunately, we've had a lot of great years. I'm concerned about the headwinds moving forward with the one big beautiful bill and some of those changes, is we're gonna maybe see some of those headwinds go the other way. And so that was kind of how we ended the conversation with the court.
So it's more of a educational type thing on the hospital district part versus what the county actually.
Exactly. They're
Listen,
two
okay.
entirely different kinds of
Okay,
financing
okay.
that goes on. To Kim's point, we do use consultants. In fact, some of the board has heard from Mike Spivey when he's come here and speak about just where he thinks his crystal ball will tell us what we're going to get as far as some of that supplemental funding. Since COVID, it's really been off. I mean, whatever it is that we think we're going to be able to get and therefore put into the budget has been really off. But we've got to make a good estimate. And we have to do it fairly early. Remember, we start our budget about March, and we're kind of looking back at that point and then kind of looking at where do we expect our supplemental funding to be. Even the tax revenue, the ad valorem, we're not certain at that point as we're setting the budget. It's not until the court sets our tax rate that we're even certain about that. And then, of course, we don't know from year to year what our payer mix is going to do. The better payer mix we have, the more revenue, of course, that we're going to bring in. It's fortunately with volume, we've been able to kind of keep our revenue from patient that actually has a payer. So all of that is really going on, and you're trying to figure out one point in time, I'm setting that budget and I'm presenting it now to the board and to the court. And
So even the tax rate that they came up with may or may not even be, I mean, it can affect the actual budget that you really don't know what it's gonna be with all of these other factors.
we don't know at the time right now when we're setting the budget where that's going to settle out. Yeah. So we've got so much uncertainty environment that we're trying to navigate and try to get to what is a good budget. And then I think having the master facility plan also, we've got to take that into account. I think if we did not have that, where we're really putting money aside, it makes it a little bit easier for us, but we're navigating two things, trying to save for this master facility plan and at the same time taking care of the hospital district needs. So very difficult environment.
So when you look at our budget and Commissioner's Court, even setting the tax rate, they're not looking at those things that are hitting us or coming in or coming out. They're just setting the tax rate based on.
Yeah, they're looking at it after it's happened. It's easier to look at it once you've got the money there, but they're looking at it after we've had whatever's come down from supplemental funding, which has been good over the last, 3 or 4 years. But it doesn't guarantee, and I think that's what Kim's saying, we're not guaranteed to have that positive distribution of supplemental funding every year.
Do you have any line of sight how, you mentioned it, but this big bodacious bill, how it's gonna affect disproportionate Medicaid for Texas? And then I know y'all are working on the line of sight, but I think through the Freedom of Information Act, we were like how Harris, Parkland, get a little ahead of us there, but is there even gonna be money to?
So the state directed payments, Texas filed in May and got approval. So for the next few years, we're okay on our directed payments. And yes, it's
Yeah.
more than a year.
Mhm.
So however, we are seeing from the One Big Beautiful Bill, other things such as the premium supplements for ACA, open enrollment starts on the 1st, and that still hasn't been settled. We know it's an issue with the government shutdown, right? So the Democrats want those reinstated. That will have a significant impact on us. Those patients will shift to either connection or self-pay. They won't go into Medicaid because they would be in Medicaid today if they qualified for Medicaid. They wouldn't be paying for ACA coverage. And so we have that. And then next year, we'll see another impact as they have required Medicaid, the states, to make sure that the not lawfully present individuals are off Medicaid because there were so many waivers during COVID. During that time. So we continue to evaluate what the impact is. We're fortunate we are in a red state. We didn't expand Medicaid. We wanted to expand Medicaid because that would have been great. But now on the flip side, we're benefiting from not having expanded Medicaid. We're gonna see uninsured. To your question about the dish reduction that we saw, we are still doing the analysis. The data we got came in a PDF file, so it didn't come in an Excel file. So we're having to do a little manual work. So,
Wait as much as they can, yeah.
so we are reviewing that still. So.
Any other questions for Kim?
I had one question, Kim, on your performance ratios, and I don't think this was one of the financial goals. I don't think operating margin is one that we're tracking for HR purposes, for employee compensation purposes. Some of these goals.
Operating margin is part of the AIP.
Why are we including ad valorem tax in that?
Why are we? So when we calculate operating margin, we include ad valorem and interest expense to align with industry standard for calculating all the revenues that would contribute to operations, to supporting the costs of the services of the organization.
Well, I'll go back, I think I was the one pushing the financial ratios, and I specifically wanted to exclude ad valorem tax from any of the ratios, that we have no control over that. And it's a mistake to include that in anything that affects employee compensation. That's been a big initiative of mine since I've been here.
Blake, can we go back and look? Because I remember this conversation last year, but I thought we had worked with you and Trent to get across the finish line how we would do it as it regards to
Yeah,
the
let's go back and-
AIP. Because otherwise it'd just be negative numbers. We'd be less negative on operating
Yeah,
margin.
you're right. Well,
Yeah, and I think and Kim does, don't you show it without?
We have that in
yeah.
there
yeah.
as a separate line item so that we can see it. Some of the concern is we have a lot of expense, like for example, with the jail, we have all the expense for taking care of the jail, but none of the revenue, which is sitting in the ad valorem, for example. And so it's really important. We are getting a revenue stream to take care of those patients, and that revenue stream needs to help to cover the expenses for taking care of all those patients. So it's really important. We look at our operations because the ad valorem is there to support operations.
We'll go back and look at this
Yeah, this has been
and meet with you because I remember this
thoroughly
conversation.
discussed on how we present ad valorem on our financials, and our auditors have included an operating margin that's down at the bottom.
It's below the line too for us here on our income statement.
It is, and that's the auditors consistent, but in the healthcare industry, you usually would include all the revenues that are to support operations when you calculate your operating margin.
Okay, well, we're going backwards then on some of these because this is.
And Blake, I apologize, but I wasn't part of that conversation. So I think Dr. Duncan's point too, we can have another conversation.
Okay, just
Yeah.
leave it off.
Okay.
I'd be happy to
Yeah.
attend as well, Blake. So, but I hear the concern there, but I also see that it's on the bottom line. It's on this consolidated income statement. And But happy to discuss further. And then, yeah, Demetria, kind of back to your question. The concern is if you look at page 19 here on the income statement, last year, we budgeted $138 million worth of income. We made $262 million worth of income. So we almost doubled our income. So that's why we keep getting hammered because we keep outpacing our budget year over year. But, the crystal ball is an issue, the supplemental's an issue. So,
Largest part of that comes
Right.
from its supplemental.
so I guess my question is based on this year's budget, I mean, do we have any feel? I heard, Dr. Palo's, question about a dish and all that. I mean, do we have any hunch as to what the supplemental may look like this year?
It's what's in the budget right now.
Okay.
So we have no other crystal ball right now. We also know that the state's gonna rebase the uncompensated care calculation in March.
We don't know.
We have
Okay.
no idea which way that will move.
And so just to be clear, we netted $262 million and that was a 7.9% net margin, right?
That's 7.9 is the operating margin.
Okay, that was the operating margin.
Yeah.
Gotcha.
Including the ad valorem and interest expense.
Okay. So moving forward, this goes to our auditors and we expect that in what kind of a time frame?
The audit will come to the joint board meeting in early December.
Great.
For approval. Right now, just to give you an idea, there's nothing that they have risen that said they see as an issue, which is consistent with history on our audits.
All right. Thank you. Any other questions? Okay, then we'll move to item B. I'm sorry, I need to get a motion for item A. If I could get an approval? Okay, Dr. Casey. Second, Dr. Fowler. Everyone in favor, say aye. Aye. So the motion is approved. So item number B is also Kim, please.
Yes. So you have in front of you a request for approval for Hilltop Securities Asset Management. They are our investment advisors for our funds that we have, our over $2.2 billion in investments. We are required by the Texas Public Funds Investment Act in order to go out technically every 2 years, although the governing board can extend that, but we can only have a term of 2 years. The 620 is the cost for 2 years at $310 a year. We were at the equivalent of $840 or for 20 a year. So we did get a reduction of our fees of over $100,000 on an annual basis as part of this process. We had 3 respondents and we chose based on the RFPs to go with the incumbent to move forward.
And just to clarify, Hilltop is not our auditor. They are our third party that we're using for our bonds. Is that correct?
They're a third party who's doing our investment advising.
Okay,
of our-
but they're also
They
doing
also
the
do-
bonds.
They
Okay,
do debt advising for us, but this is for the investments.
More
Gotcha.
consulting. Mhm.
So one question. We had 3 respondents, chose Hilltop. We chose Hilltop because of their past experience with us. Or they were just best package.
They were the best package, their fees were the best. Oftentimes the incumbent also understands you better, right? So when they respond, Meter Investments and PFM Asset Management were the other 2 respondents, and they just were not as strong in their response. And so we had a committee that looked at it, mostly finance people looking at it, and we made the decision that Hilltop came out as the best option for us. And remember, they're an advisor. They aren't a outsourced chief investment officer where they act independently. We don't give them the authority. They just give us the advice.
and do you typically look at that based on a percentage of the assets or, okay,
Yeah, it's 1.5 basis points.
1.5 basis
roughly.
points?
Yeah, it's a tiered approach to the fees. So once you
Right.
get over 1 billion, it actually goes down more.
Kim, could you repeat earlier about they're giving us advice or they're acting on it?
They are giving us the investment advice and acting on what we approve.
So every trade gets approved?
There's most of the financial investments that we have don't involve those types of trades. It would be mostly changing and the
Uh-huh.
debt instruments that we're allowed to invest in, because our investment portfolio is not as complicated as you would see in a foundation or your personal portfolio. We're very limited in our investments relative to other organizations.
So when they need approval, how do we give that approval?
We review it with them. They come here, by the way, annually. They'll be here in November to review the annual investment returns, and they follow our investment policy
And is that a board approval or staff approval?
for changing the investments.
Any changes that need approval, who grants that? approval?
As long as they stand within policy, it's management.
Yeah, but they may ask the board, you know, if the year looks different and they see within the policy, they can move more. They may make that recommendation at the point that they're making that presentation to the board.
But if they're wanting to buy some more bonds or municipal bonds or money market instruments or whatever they're purchasing, does every purchase need approval or
No.
does it just have to fit within the policy?
It has to stay within the policy, but they're not acting independently. They are working with management, and we aren't making trades daily. We're staying in the funds because these are long-term funds that we're invested in. And so we're not making monthly changes or weekly changes like you would maybe if you're trying to time the market. So,
They may be adding or subtracting cash depending on,
right, and that's based on the investment policy.
but if they're adding more money to the investments, that doesn't need approval.
No, so as we gain cash as an organization and we gain cash, it's invested consistent with the investment policy and the asset allocation.
Okay, I guess with that, we'll take a motion on item B. Okay, we have got, I'm sorry, Dr. Davis and first, and I've got a second from Demetria. With that, I'd like to take a motion here. Everyone in favor, please say aye. The motion passes. Okay. Number C will be presented by Phyllis Chambers. It's to consider approval of the Agility Equipment Rental Services pricing between Tarrant County Hospital District and Agility Health, Inc. Phyllis, please. Thank you.
Yes, sir. It is Agility Health. It is
Sorry.
basically our just-in,
I
oh,
like the
you're
way you
fine.
said that.
Our just-in-time rental agreement with them. They are also a part of our GPO vendor. We did put this out for RFP. We got one respondent, and that was them. And we already have an existing relationship. The current contract is for $1,351,000 over a 5-year term, resulting in $270,200 a year. And I would ask for your approval. It's for the lasers for certain procedures in urology, as well as some of our coagulation or blood clotting therapies. Any questions?
There's that one question,
Yes, sir.
one respondent. And I know we have a previous relationship with this company. Do you think that company does not respond based on our relationship existing?
Oh, no, not at all.
Why we only had one response?
Well, I mean, it's publicly published out there for us to get as many respondents. However, I don't think that necessarily impedes them. It's just a matter of can they provide the services that we need and the scope that we need within our hospital setting. So that's usually they'll self-exclude themselves in the event that they can't provide that type of care or the type of equipment that we need. And in the just-in-time, because this is a just-in-time contract. So in other words, if Dr. Davis decided he wanted to do surgery on somebody and we did not have that particular piece of equipment, then we would be going to this vendor to get that piece of equipment for that particular surgery. And then we would have them go back with it. So it's just scope and size.
This is same company, but separate contract
Yep.
from like our vendor. So
Yes, sir. It's a different arm.
No further questions. If I could get a motion.
So moved.
First for Dr. Casey, second Dr. Davis. All in favor, say aye. The motion passes.
Thank you.
Okay, item D, Brian. We've got consider approval of Amendment 3 to the oral maxillofacial lease agreement between Tarrant County Hospital District and Oro Oral Maxillofacial Network PLLC. Go ahead, Brian.
Good morning. Yes, this is a extension of a current lease. Will run January of 26 through December of 28. They've been in this space for many years. I think it's eight or 9 years. Thank you. Plan would be to, at the end of this current, if this is approved, that at the end of this lease, they would move into JPOC space.
And one correction, this is income to us, right?
Yes.
Yeah.
Yep, this is an income, not a cost.
I don't know, I was gonna say, why are we paying? them?
Thank you, Daphne.
This is Dr. Stella's space. Mhm, mhm.
Any further questions for Brian? Okay, with that, if I could get a motion. Okay, we'll get first Dr. Fowler, second Dr. Casey. Everyone in favor? Okay, the motion passes. All right, Brian, looks like we're up again here.
Yes.
So consider approval of the initial guaranteed maximum price amendment two for the central utility plant between Tarrant County Hospital District and J.E. Dunn, a joint venture. Brian, go ahead.
Yes, this is for $119,351,594. This is part of the overall budget for the central utility plant and includes some concrete, some precast work, plumbing, mechanical, electrical. Will keep us moving forward on the current schedule. Any questions on this one?
So when you say J.E. Dunn, are they overseeing this entire project or what is their
So
capacity?
J.E. Dunn is the general contractor
Okay.
under a CMAR contract for both the central utility plant and the medical outpatient building.
Thank you.
But it's a joint venture, J.E. Dunn / Source. Source is another construction.
Oh,
management company.
I'm sorry.
Joint venture.
Yes,
But to your point, J.E. Dunn will be running, they'll be the primary.
Right.
CM on the project.
Okay. All right.
Is this the total cost for the entire?
no, the,
So just for the concrete?
I apologize. This is just the second GMP of the total budget. I do not have that number in front of me. I apologize.
So this is the GMP for the, what you have here, concrete, the hoisting, concrete, precast, plumbing, and the MEP for the cup.
Correct.
So is this 100%, are we in construction design with this already, or are we still in design with this?
Well, both. If I refer you to the graph that Ramon presented earlier, we're in that period where design is overlapping construction. So this is still some of the make-ready work and relocating utilities and preparing concrete for some of the switch gear. That's and the plumbing and mechanical rough ends, the utilities. So this is what we would define as some of that make-ready work. So we're not constructing the building, we're preparing the site for the building construction to start next year. If that
So, and
helps.
I'm just asking, since it's a GMP, so their number is not gonna go up, that 119 million is not gonna go up. They're not gonna come back with a change order
Correct,
to interfere with what the construction cost is gonna be.
correct.
Well, Brian, can you tell us anything about Source, the other partner in the joint venture?
Well, our primary work is with Dunn. I know I can't explain who's doing which parts of the project. Is that your question or are you?
A little bit about who's Source.
And I apologize. That joint venture was put together before I started. I don't have a ton of history. If you have that.
Source Building Group, they're located in Mansfield, Texas. They are the minority partner that came in with J.E. Dunn. And a lot of times the construction managers will come, the CMs like J.E. Dunn will bring in a minority or woman-owned business or small business, local business to partner with to help them come in to grow capacity. So Source would be his value to the team would be, he'll have some value to the team of bringing either staffing, or he's gonna be self-performing some part of this project. And his other value to the team, and you can always hear me especially talking about, are we gonna be reaching out to local and small businesses? That's a role that Source will be playing as well, to make sure we're reaching out to these other small businesses that perform concrete, precast, plumbing. And those are things we as a board should keep our eye on to make sure that that participation is coming in, or that utilization is coming in. Would you agree?
How do you keep your eye on that?
Because they're gonna be, Jill and Daphne and compliance is gonna be tracking what we spend. Ramon, that's his job. He's gonna be tracking that 119 million, how it's gonna be spent. Material, how it's going out into their fees. I mean, they're gonna be tracking those expenses.
It's part
We
of
have to
the,
report those expenditures every month.
correct. It's part of the contract requirements. We have participation goals in our contracts. And so as part of their, contract execution and monthly invoicing, they report what contractors are doing, what level of work. So we can monitor that and report as necessary.
But what's not clear, and you probably can help with that, we don't know what that goal is. Or is there a goal?
Correct. I don't know what they put in their response in terms of.
Yeah, we just need to follow what that goal is, whether it's 20%, 25% of that contract value, and that's how we're gonna be tracking.
I can report that. I said I can report that back. But yeah, as far as what the specific scope is, are they doing electrical or site work? That has not yet been defined.
Any other questions for Brian? Okay, with that, if I could get a motion.
Make a motion to.
Okay.
$351,000.
All right, thank you, Demetri. First, second. All right, Reverend, thank you. If I could get a vote on this, please. Everyone in favor, say aye. All right, the motion carries. Okay, item F, Brian, again here. So as a consideration approval of the initial guaranteed maximum price amendment 2 for construction of the JPS Medical Outpatient Building between Tarrant County Hospital District and J.E. Dunn Construction Company. Brian?
So yes, thank you. And this one is with J.E. Dunn specifically. This is again, a second GMP issued for the medical outpatient building. Some structure, exterior skin, again, mechanical, electrical, plumbing systems. This is GMP number 2 of this project. This is $216,711,827. And, this component is, takes us to a total of 257 million committed out of the 361 million budgeted for this project. To answer the question that was asked before, I apologize, I didn't have the CUP details in front of me.
How does an RFP work in the scenario? We've already had a relationship with J.E. Dunn. We're already contacted. So were we to choose another one of the other 4 respondents, how would that play out?
Are you talking about the? Yeah, yes. So this is already awarded to them. It's just referencing that there were 5 that responded to the initial.
Yeah, long kind of.
Yes.
Yeah, okay.
Yeah, so the only thing we'll be tracking are the contractors that they bring onto the job. And which is really if I may.
Mhm.
Since J. Dunn has 2 projects, the CUP and this MOB, we're probably gonna get, I'm assuming, a better price because they're gonna be ordering all that material and they're gonna already have the lay down area already here to make sure this number is not gonna go or creep up, because now I'm assuming they're working on all the long lead items right now.
Yes, yes. As a matter of fact, their current meetings, discussion, air handling units, chillers, the big equipment for all the 3 projects. So the central utility plant, the hospital, and the MOB, we're bulking those purchases together to maximize our discount. And that's part of our procurement strategy across the master facility plan projects.
Right, because this is still in design, is that correct?
Yes.
This particular project?
Yes.
Okay. So the purpose of these requests is that we're starting to combine them with, to get a better buying power and to start pre-purchasing these big items that get long
Yes.
lead times.
Yeah, and so it's the savings on bundling and it's also those long lead items that we're facing in the market.
It's a benefit for Don and us.
And it's also a benefit that we're doing it now before these other hospital projects start kicking off here in the next 6 to 8 months. You know, we'll be ahead of the game by purchasing, you know, all of this material, or at least come up with the plan and the budget for that.
Yes, getting this commitment out helps with many things, what you mentioned in addition to labor. So now we have hard schedules, we can get commitments because with all the other projects in the area, labor will be a challenge to
Labor and
make sure we
supplies are
have
gonna
qualified
be
trade
challenging.
partners showing up.
The current crystal ball is we can order all this stuff soonish and have.
Yes.
On it here.
Yes, yep, this all aligns that master schedule we showed or Ramon walked through earlier, all of those long lead items within those schedules, these GMPs are issued to Target to make sure we have material on site when we need to hold those schedules.
Any further questions for Brian? Okay, with that, we'll take a motion. Okay, got first, Dr. Fowler, second, Demetria. Everyone in favor? All right, motion passes.
Thank you.
Thank you. All right, Joy. Okay, item G, so consider approval of Seismic's addendum to Vizient contract LB 0853 between Tarrant County Hospital District and Seismic's America, Inc. Joy.
Yes, thank you. So this agreement provides the reagents, consumables, as well as upgraded equipment for our hematology analyzers that are both in our main laboratory here as well as our oncology infusion center.
All right. Sounds good. I've got a first, Dr. Davis. Okay, second, Dr. Casey. Everyone in favor? All right, the motion passes. Thank you, Joy.
Yep.
Let's see here. Last item for the day, item H. So consider approval of the purchase agreement between Tarrant County Hospital District and the Central Admixture Pharmacy Services, Inc. Joy, go ahead.
Yeah, so this, the purpose of this agreement is to provide the district with 503A and 503B compounded products for the district's inpatient pharmacy. Essentially, this is total parenteral nutrition, so our TPN. And this was awarded via RFP, was the incumbent that we've had a longstanding relationship with.
Any further questions? I'd like to get a motion, please. All right. Reverend, second, Casey, everyone in favor? The motion carries. Okay. So, closed session is next. Believe we've got nothing on closed session.
Take the closed session.
So that adjourns us at 11:02. Gavel's up. All right.
Sounds